It may not feel like it, but each and every one of us have a job. Sure, it's not a job you get paid money to do, but think about it. Between math problems, reading assignments, history lessons, and science experiments, we do a lot of work. Being a student can be a tough job sometimes. Do you ever wonder what it's all for? Well, the good news is that we aren't going to be students forever. After we're all done with school, we'll get to choose a new job, one that lines up with our interests and goals. That doesn't mean we have to wait to start looking at our options, though. In fact, it's probably a good idea to start taking a look around to see what careers might be for you. Don't get frustrated if you don't find it immediately, or even change your mind a few hundred times. The best thing we can do now is to know what jobs are out there, and if they look like something we would be happy doing. In this video, we're going to take a look at a day in the life of one job in particular, a dentist. You might already know some things about dentists just by having gone to yours a couple of times, but there is a lot more to it than just telling people to brush and floss correctly. We're going to look at a normal day for a couple of dentists and their patients. As you watch this video, think about if this would be something you would be interested in doing. As far as jobs go, I can tell you it's way better than a math test.
Hello, I'm Dr. Smiley. I am a very important part of the overall healthcare team. I am a dentist. I went to school after high school to learn how to keep your mouth healthy. Let me show you what a normal day looks like for me as a dentist. First, I will be seeing Miss Patty and cleaning her teeth. Next, I will see Mr. Bob and filling his cavity. Third, I will see Miss Susan to cure her discomfort by giving her a root canal therapy. Lastly, I will go see Mr. Rich, who is getting new teeth today. Come with me and let's go see Miss Patty. Hi, Miss Patty. I'm Dr. Smiley. This is Mrs. Assistant. She will be helping me. How are you?
I'm doing great. I'm just here for my cleaning.
Great. How is your health? And are you taking any medicine?
I'm doing very well. I'm not taking any medication.
That's wonderful. Let's check your blood pressure.
So it's 120/70.
That's good. Let's start your cleaning.
Okay, stop. You're probably wondering why Miss Patty is wearing sunglasses at the dentist. Well, not only is she very fashionable now, but this keeps the bright light a dentist uses from hurting her eyes. It also acts as a pretty good shield should Dr. Smiley start accidentally flinging Miss Patty's spit everywhere. Alright, back to the action.
All your muscles are feeling good, and I don't see any bad spots on your face. This is my mirror that helps me see all your teeth, and this is my tooth counter. Let's take a look. Looks like you've been doing a great job flossing every night and brushing twice a day, in circles to clean your teeth and gums. I don't see any cavities, and now I will clean your teeth. Great. I will see you in 6 months for your next cleaning.
Thank you.
It's time to see Mr. Bob, who needs a filler.
So what's going on here? Dr. Smiley gave Mr. Bob a small shot of anesthetic, so he doesn't feel any pain in his mouth. Having waited a few minutes for the medicine to work, Dr. Smiley is ready to start. First, he takes his dental drill and removes all the bad spots on the tooth.
Well, Mr. Bob, looks like I was able to take out all the sugar bugs that gave you a cavity. Now let's fill this cavity to keep your teeth healthy.
What is a cavity anyway? Well, if sugar, starches, and other foods are left on the tooth too long, harmful bacteria will grow, causing an infection. Dr. Smiley calls them the sugar bugs, and eventually these sugar bugs eat away at the tooth. In order to stop the infection, the dentist removes the bad spots with a small drill made specifically for teeth, then fills the hole with a special filling, making it as good as new.
How does it feel?
Feels exactly like my other teeth.
Mr. Bob, please give the office a call if you need anything. We will see if you need anything, and we will see you at your next appointment.
Okay.
Hello, Miss Susan. I'm Dr. Smiley. So you're having a lot of pain today, huh?
Yes.
Let's take a look. Based on my findings, you have a big cavity in this tooth. The sugar bugs have eaten your tooth all the way to the nerve. This is why you're having pain. So today I need to remove all the sugar bugs, remove the nerves, put some medicine inside. Then I'll fill the hole where the sugar bugs ate the tooth. Then I'll put a crown on top.
What's a crown?
This is a cover that sits on top of a tooth to make it nice and strong. It is important to remember that crowns still need to be brushed just like other teeth.
Miss Susan looks like she'll need a root canal to stop the pain in her mouth. So what is a root canal? When a tooth has a cavity that has gotten too deep or been cracked or broken, a dentist may need to do a root canal. How does somebody know they need a root canal? Well, there are some pretty obvious signs. A lingering pain or a dull pain in the mouth. Severe or sharp pain that just comes out of nowhere, called spontaneous pain, and the area on the mouth being swollen are all signs someone may be in serious need of a root canal. To fix the tooth, there are 3 steps a dentist must do. First is to clean out the damaged area of the tooth, called the pulp. The dentist will drill a hole in the tooth and with special tools remove all of the nerves down to the root. Then the tooth is filled with a special filling called gutta percha, which keeps the tooth strong and prevents any further decay. Lastly, the tooth is then topped off with a special piece called a crown and made to feel just like the old tooth. After that, the tooth is capped and the pain is gone. The success rate for a root canal is between 83 to 95%, which is really good in the medical field.
Dr. Smiley is still working with his last patient, Mrs. Susan, so I'm going to be working with Mr. Rich. Mr. Rich didn't take care of his teeth, so he lost them, and we're going to make him new ones. The new set of teeth are called dentures, which will allow him to chew and eat better. Now let's go see him now. Hi, my name is Dr. Mulder. I know you usually see Dr. Smiley, but his last patient, Mrs. Susan, is taking a little longer than I expected, so I'm going to be working with you. Are you ready to try on your new teeth?
Yes, I am. I can't wait to eat corn again.
What do you think? Do they fit?
You look great.
No problem, Mr. Rich. I'm just doing what a dentist does.
We've touched upon a few of the things a dentist would see in their day, but this is by no means all of it. Dentists, like medical doctors and other professions, can specialize. That means they can focus on certain parts of dentistry, like helping children, putting on braces, or performing dental surgeries. If dentistry looks like something you might be interested in doing after you get out of school, try to find out more about it. You can look up more information and watch videos in your local library, or ask teachers, parents, even your own dentist to find out more. Dentistry isn't the only job out there. There are plenty of different jobs out in the world, and by the time we are ready to find them, there will likely be jobs that don't even exist now. First is to think. School isn't just here to torture kids. It's to help us become better and smarter. Sure, it's tough sometimes, but it's nothing you can't handle if you take it seriously. Another thing we can do is read. The world is full of ideas and adventures, and many of them can be found in books, whether we're reading for fun or for a school assignment. Reading puts the world's information at our fingertips. Learning means remembering what we're taught by others or pick up on our own. Sometimes it takes a little work to make it happen smoothly. Make it an important part of your life and ask for help when you need it. Play. That's right, playing is just as important as learning, reading, or everything else we do. It keeps our minds fresh and our bodies in tip-top shape. Lastly, join in on new activities and interests, whether it be sports team, art clubs, or learning to play an instrument. Doing this gets us out of our comfort zone, and shaking things up is what makes life more interesting. We hope you've enjoyed this presentation and given you some ideas and questions to ask. No matter what you do, always remember to dream big.